Well, hello. I'd like to talk to about some chronic pain issues that a lot of mothers have, and we're talking particularly today about the thyroid and how the thyroid might contribute to chronic pain like back pain or joint pain or even neuropathy. So, first of all, just a little bit about background. The thyroid gland is a little butterfly shaped gland that sits here in your neck. And it's really important because it has a lot of control over a lot of different body processes like digestion, it controls bone maintenance, it controls body composition, and it actually is tied in with heart health as well. So the thyroid does a lot of different things, and it's a very, very important gland. Now, whenever there's an imbalance in the thyroid gland, it can cause a whole host of symptoms like, thinning of the hair and hair falling out and weight gain and all that. But that's not what I want to talk about today. Today, I want to talk about how it actually affects the musculoskeletal system. And that's not something that we always think about as far as the thyroid. Is concerned, we think about all of the other things that can be caused by a thyroid imbalance. We don't think about how it affects our joints and our muscles, and that's what I want to talk about today. So there are plenty of studies out there. You can go and Google peer reviewed research on the thyroid and how it relates to the musculoskeletal system. So there's loads of research out there about this. And They can cause headaches. They can cause nerve pain, like neuropathies, carpal tunnel, similar things to like the diabetic neuropathies. It can cause joint pain, and it can cause muscle aches. And a lot of times the thyroid actually gets missed. And this is a big problem. A lot of times our primary care doctors, we love our primary care doctors. They take care of us. But a lot of times they miss things because they don't necessarily test everything. So they'll run a quick thyroid test, and they'll run maybe one or two, thyroid tests out of, six or seven that need to be run, and they'll miss it. They'll run something called TSH, which is thyroid stimulating hormone, which is an important marker because if the TSH levels are off, that tells you for sure that there's a thyroid problem. However, you can have a thyroid problem, and I've seen this a lot of times in my clinic. You can have a thyroid problem without with a completely normal TSH. And so if you're only looking at the TSH, there may be some things that you're missing. And so when I run my thyroid panels, of course, I run the whole thyroid panel. Um, there are uh, some connections to the thyroid and certain conditions. For example, migraines, migraine headaches, and thyroid dysfunction sometimes go hand in hand. And sometimes if you have migraine headaches and you haven't done a thorough thyroid check, you might be missing something. And so there's a study that shows that subclinical hypothyroidism, which means that there is some hypothyroidism, but it's not really necessarily manifesting in overt symptoms yet. So you have a thyroid problem, but it's not causing a lot of distress, and so it's kind of underlying. And there's a correlation between subclinical hypothyroidism and migraine headaches. And so for the patients to come into my office with headaches or migraines, thyroid is one of the first things that I check. And so um, and this is compared with migraine sufferers versus non-migraine sufferers. And so there is that clinical correlation between the migraine sufferers and subclinical hypothyroidism. 26% of people with headaches also have an increased risk of developing hypothyroid problems. So that's a pretty, that's a quarter. That's one fourth. One in every four person that has headaches will develop thyroid problems. Another study that shows that there's a correlation between, excuse me, a correlation between the thyroid antibodies and neck pain with headaches, and it's particularly involved with those that have Hashimoto's syndrome, which is a form of hypothyroidism. But a lot of my patients come in with neck pain and headaches, and sometimes the neck pain and the headaches are correlated, and sometimes there's also an underlying thyroid problem. So neck pain and headaches, check your thyroid. Thyroid and back pain is also related. So 79% of people with hypothyroids may have something called hypothyroid myopathy. Myopathy is a problem with the muscles, and so 79% of people that have thyroid problems are also going to have muscle aches, and especially muscle aches in the back. And a lot of times that'll contribute to problems in the shoulder and problems in the pelvis. And also, it causes a lot of fatigue, and it can cause pain with exercise. Exercise shouldn't produce any pain at all, but if you're having pain in your muscles while you're exercising or shortly after exercising, you might have a thyroid problem, and it'll be really important for you to check that. The thyroid neuropathy, there are a few studies that show that thyroid and nerve problems are also correlated. In fact, the thyroid imbalance is implicated in the diabetic neuropathy. So if you have diabetes and you have the diabetic neuropathy, you might also have a thyroid problem, and vice versa. Peripheral neuropathies, carpal tunnels, burning in your feet, that burning or numbness or tingling sensation in your hand, could all be pointing to thyroid problem as well as nerve entrapment. And so it's important that you check the thyroid whenever you have those neuropathies too. Now, in addition to that, the thyroid dysfunction can cause weight gain, and weight gain increases the pressure on the nerves too. And they think it's because of the extra water retention that compresses on the nerve. And so again, that thyroid problem can lead to what feels like a pinched nerve. And so if you're doing therapies for a pinched nerve and you're not getting results, think about your thyroid. And thyroid and joint pain is also related. It also has to do with the weight gain. If you have weight gain because of thyroid issues, you're going to have problems in your knees and your ankles, your feet, your hips, and your low back. And there is also a correlation between thyroid antibodies and knee pain as a secondary mechanism, where they think that there's extra calcium that gets put into those joints. And if you can imagine, you've got extra calcium in your joints because your thyroid isn't working properly, you can imagine that stiffness, the achiness, the soreness in your joints because of that extra calcium. So I hope this kind of gives you some things to think about. Please give me a comment. Check out our website, www.simplychiropracticlc.com. And if you think you might be having some of these thyroid problems, please give us a call so that we can check it. I do run labs, and they're very inexpensive labs. You can get the same types of labs directly from the labs, and my cost is even less than that. So it's a great deal, and we can get to the underlying cause of your problem. So if you are having back pain, headaches, and things that are kind of interrupting your day, making it difficult for you to get through your work week, making it difficult for you to take care of your kids and run a household and spend time with your loved ones, then give us a call and let us help. Thank you so much. Have a great rest of your day.